Hi, I'm Dr. Golewale. I'm a board certified vascular and interventional radiologist, and I have been working as a vascular specialist in Chicago and Northwest Indiana for approximately 15 years. Chronic hemorrhoids are chronic vascular painful structures in the rectal area. Hemorrhoids require treatment when there are symptoms such as bleeding, pain, itchiness, abnormal abnormality with the bowel movements. There are few options to treat symptomatic or painful hemorrhoids, such as sitz bath, topical pain medications such as preparation H, but there are also more surgical options such as hemorrhoidectomy, uh, colonoscopy with banding technique, or hemorrhoid artery embolization. Hemorrhoid surgery has been around for a number of years, but the main drawback is painful recovery time. When surgeon cuts on the mucosa of the rectum and removes the hemorrhoids, it's a good surgery, but however can have very painful recovery that sometimes patient had to sit on a donut for up to 2 months, and they will have painful bowel movements and sometimes bleeding. Rubber band ligation is usually performed with a camera or colonoscopy or a sigmoidoscopy. The drawbacks could be that the rubber bands could slip off or could get dislodged, and also the recovery from the procedure can be quite painful. HAE stands for hemorrhoid artery embolization. It's a minimally invasive endovascular procedure. In this procedure, we do embolization or blockage of blood flow to the hemorrhoids. This is the only procedure which is not done through rectum for hemorrhoids. All the other treatment options we have for hemorrhoids, such as surgery or rubber band ligation, they are done through rectal area. But for HAE, this is a endovascular or vascular procedure that is done through a small pin-sized hole in the artery in the upper thigh, and a small catheter is fed through those arteries into the pelvic area, and we find the feeding vessel to hemorrhoids and block it from inside. After HAE procedure, which is, by the way, is done as an outpatient, so the patients come and go home same day. Most of the patients will not experience any side effects, or complication risk is very, very small, but there is always possibility of minor bleeding in the groin area, or minor bruising, or minor pain at the puncture site in the leg area. That may usually resolve with just icing it or Tylenol or Motrin. As such, for hemorrhoid itself, we do not expect any pain in the rectal area. Usually, in my experience, the hemorrhoids shrink without much pain, and the recovery is usually for within 24 hours. At NG Vascular and Vein, we perform HAE, which is a hemorrhoid artery embolization procedure for painful and bleeding hemorrhoids, is done as an outpatient. The patients come and go home same day. They are here for maybe 2 to 3 hours at most, and they go home and recover at home. We take almost all insurances. They are covered by most insurance plans in Chicago and Indiana region. The procedures are near painless and is very cost effective.